Heavy menstrual bleeding due to a dysfunctional uterine cycle is one of the common problems for women of all ages. Extensive and heavy periods are not just uncomfortable, but they also put the health of the women at risk due to excessive loss of blood. Hormonal pills and surgeries such as hysterectomy are some of the common solutions that are often prescribed. However, they do not solve the problem, but often create severe hormonal imbalances that lead to chronic health disorders going forward. Ayurveda, a holistic system of medicine, provides effective natural ways to find relief from heavy menstrual bleeding and prevent it at the root cause level. Ayurvedic medicines, along with dietary and lifestyle changes and yoga therapy, are some of the helpful ways in which you can prevent and stop heavy menstrual bleeding. Hi, this is Nidhi Bansal here from Ayurvedic Herbs. We help women to gain health with all natural and holistic principles of Ayurveda, and in this video I will share with you highly effective Ayurvedic ways to find relief from heavy menstrual bleeding. Let's get started. Heavy periods and abnormal uterine bleeding is most commonly observed during early years of adolescence in menarche and during years leading up to menopause. This is because in both of these ends of the reproductive life, the menstrual cycle is not fully established. It's irregular. For example, in early years of menarche, the ovaries have not really started to release egg on monthly basis. There is irregular ovulation and hence irregular flow of hormones in your body. This leads to multitude of menstrual problems in young girls, of which heavy menstrual bleeding is one. However, this is not normal, and Ayurveda can help you to find relief from these hormonal imbalances as well as build the foundation for healthy regular menstrual cycle going forward. On the other hand, in the later phase of your reproductive life, in perimenopause, the ovaries are kind of shutting down. They are stopping the production of egg on a regular basis. That's why there is also irregular ovulation, and hence sometimes egg is released and sometimes it may not be released. At the same time, women really go through a lot of hormonal changes beyond 35 years of life. This is because estrogen and progesterone have started to go down in a regular fashion, but your body has natural ways to cope with these hormonal shifts. However, in perimenopause, when there is irregular ovulation, this can lead to situations of hormonal imbalances and hence multiple menopause symptoms, of which heavy bleeding and regular spotting is one. Now let's look into what exactly happens that leads to heavy periods and abnormal uterine bleeding during your menstrual cycle. The most common cause of heavy bleeding or abnormal uterine bleeding is anovulation. That means the ovulation is not happening or the ovaries are not able to release the egg. When that happens, then corpus luteum, which is a mound of tissue that produces progesterone, is not formed. As a result, you may experience symptoms of high estrogen levels or estrogen dominance and progesterone insufficiency. When that happens, then estrogen can keep stimulating the uterine lining to make it very thick and irregular in size. Thus, under the action of estrogen, the uterine lining keeps building up till it becomes too bulky to hold on. This is also termed as bulky uterus or endometrial hyperplasia, in which the uterine lining is extensively thick. This may happen in all of the cycles or in some of the cycles, as a result of which you experience this irregular bleeding or bleeding and spotting in between the periods. Eventually, the uterine lining slows off in irregular intervals. This is also termed as breakthrough bleeding, which leads to irregular menstruation, heavy bleeding, gush of blood, or heavy periods with extensive clots and spotting in between the periods. Since the uterine lining has become very thick, the menstruation that happens as a result is usually longer in duration or heavier in nature. Some of the other causes of abnormal uterine cycle and heavy menstrual bleeding are structural problems in the uterus, such as adenomyosis, uterine fibroids, endometriosis, or uterine polyps, which really change the structure and the type of uterine lining that is forming inside each cycle. When this is irregular, it leads to formation of clots and irregular bleeding, thus a lot of pain and discomfort that you may be struggling with. Certain medications such as hormonal pills or insertion of IUD devices and even blood thinning medication can also affect the formation and the type of uterine lining, thus affecting your menstrual cycle, making it heavier than usual. You may also experience heavy periods with clots or irregular menstrual bleeding in health conditions such as thyroid disorders, PCOS, liver problems, fatty liver, excessive fat in the body, obesity or diabetes. In all of these health conditions, you are also experiencing symptoms similar to estrogen dominance and absence of ovulation as a result. This also leads to the formation of irregular endometrial lining and hence phases of heavy menstrual bleeding or cycles in which one cycle is very heavy and another is light, and subsequently you may experience unpredictable bouts of spotting or mid-cycle bleeding. In Ayurveda, extensive periods of heavy bleeding or bleeding with clots is termed as Raktpradar or Asrikdara. It happens as a result of imbalance in Vata and Pitta dosh, which affects your Rakta Dhatu, Rasa Dhatu as well as Mamsa Dhatu, the muscle tissues. Together, all of these tissues are responsible for the formation of your menstrual lining and the quality of menstrual blood. Whenever there is an imbalance in Vata dosh, which controls the elimination or the flow of menstruation, and Pitta dosh, which controls your hormonal balance or the thickness of your uterine lining or the quality of your blood tissues, it leads to an imbalance in your menstrual cycle. That's why Ayurvedic treatment for heavy menstrual bleeding is really focused towards balancing Vata Pitta dosha and supporting the quality of the body tissues, such as the Rasa Dhatu, which symbolizes your lymphatic system, and the Rakta Dhatu, which symbolizes your circulatory system and the quality of your blood tissues, and your Mamasa Dhatu, the quality of your muscle tissues, which regulate the formation of the arteries and the blood vessels. To find relief from heavy menstrual bleeding at the root cause level, Ayurveda prescribes several measures that involve intake of herbal supplements, dietary lifestyle changes, as well as supporting your mental wellness. So here are the 5 best Ayurvedic ways in which you can find relief from heavy periods in a natural manner. Number 1 is to change your diet and make it Vata and Pitta pacifying such that you are taking timely meals. Your meals are nourishing in nature. That means they contain naturally sweet tasting foods. Some of the foods that you should include in your diet during bouts of heavy menstrual bleeding, specific and during rest of the menstrual cycle, are beans, lentils, green leafy vegetables, which also contain a lot of magnesium and iron that you need at the moment, beets, antioxidant rich fruits, vegetables, and sufficient amount of proteins. All of these dietary changes will really help you to get the right nourishment, boost your iron levels, and also provide you required energy to fight fatigue during heavy bleeding. The second thing that you can do is to practice yoga asana that will help you to relax, calm down, and also soothe the pain, fatigue, and inflammation that is present in the pelvic region. Some of the yoga asana that you can practice are here. In addition, do make sure to conduct regular breathing exercises which will infuse a lot of prana and improve the circulation and hence the quality of the Rakta Dhatu and Rasa Dhatu in specific. Pranayama and breathing exercises also help you to relax, thus reducing your stress levels and hence support the hormone balance. The third effective way to manage your health during heavy menstrual bleeding and also to stop menstrual bleeding will be to take Ayurvedic herbal supplements under the direction of an experienced Ayurvedic doctor who can help you to identify your specific imbalances and hence prescribe health protocol that will help you to find relief from all the symptoms, regulate your menstrual cycle, support regular ovulation, and hence your fertility and hormone balance. The fourth measure that you can take to manage your health during heavy menstrual bleeding and to prevent it from occurring is to take sufficient rest and clock in regular sleeping hours, especially during the night time. It will also help you to regain the energy and fight the fatigue that you are currently going through as a result of extensive blood loss. Sufficient rest and sleep will also help you to balance the hormones, find relief from the symptoms of estrogen dominance or excess estrogen in your body. The next thing that you need to do is to stay hydrated with increased amount of water, fresh fruit juices, coconut water, herbal teas. All of these are important measures that will give you required amount of energy, help you to fight fatigue, improve circulation, and hence prevent heavy bleeding in the first place. Now last but one of the most important measure is to fix the root cause of heavy menstrual bleeding. If you have any of the medical conditions such as hypothyroidism, diabetes, PCOS, endometriosis, uterine fibroids, adenomyosis, liver or kidney conditions, then you are really prone to hormonal imbalances that we discussed in here. All of these hormonal imbalances also lead to heavy menstrual bleeding and many of the other symptoms that you are currently struggling with. That's why it is really important to address all of these conditions so that they do not progress, causing more health complications and hence putting your health at risk. A timely treatment not only helps to prevent complications, but it also builds the foundation of finding relief in a faster way. This is because when your symptoms become severe, then it takes more time and stronger medication to find relief. In some cases, the conditions can also come to a stage when it is difficult to reverse them and it is difficult to come back to balance. That's why early intervention and early treatment is important to save you from discomfort and also build your health in the long term. So that was all. I hope you found it useful. Do leave your comments, suggestions and feedback. I will get back to you. Do subscribe to Medhya Herbal channel so that you stay updated with the latest helpful Ayurvedic tips to stay in the best shape of your health. Do like and share this video with all who will find it useful. I will see you soon in the next video. Until then, bye.